name's Riley Gordon. This will be my head-to-toe exam for Adult Health 1 Clinical, which is 7604-M51. Today's date is 28th of August. This is for the fall semester of 2023. This is the room, ceiling, and floor. And these are my tools. And we'll go ahead and start now. Throughout the exam, I will be assessing skin of the head, neck, face, anterior and posterior chest, and abdomen. I'll be assessing for skin color, texture, turgor, temperature, moisture, nevy, lesions, scars, bruising, and edema. I'm going to inspect the head for size, symmetry, position for midline between the shoulders. I'm going to inspect and palpate the head for hair texture, hair color, hair distribution, masses, tenderness, lesions, infestations. I'm going to palpate the temporal arteries for tenderness. I'm going to palpate the lymph nodes of the head and neck, starting with the occipital, posterauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. I'm going to palpate TMJ, open and close your jaw, for crepitus, subluxation, and tenderness. I'm going to go ahead and assess cranial nerve 5, which is trigeminal, or starting with sensory. I'm going to be assessing light touch. Close your eyes. Tell me when you feel this.
Feel it.
Of the forehead,
Feel it.
cheeks,
Feel it.
nose,
Feel it.
and chin. I'm going to assess the motor part of that by palpating the masseter muscle. Clench your jaw. Perfect. Cranial nerve 7, which is facial. I'm going to assess for symmetry. Raise your eyebrows, smile, frown, puff your cheeks, pucker your lips. Perfect. Move on to the ears. We're going to inspect and palpate the ears for shape and position. I'm going to palpate the pinna and tragus for masses and tenderness. I'm going to inspect the auditory canal and tympanic membrane with my otoscope, pulling the ear up and back. Same thing on the other side, up and back. And then I'm going to assess cranial nerve 8, which is vestibulocular, with starting off with the whisper test. Cover your left ear for me. Repeat after me.
1, 2, 3.
Cover your right ear for me. Repeat after me.
1, 2, 3.
All right. And we're going to do the Weber test. Look at the lateralization. Can you hear this equally both ears?
Yes.
And Ryan test, which is starting with bone conduction. Tell me no longer hear it.
Can no longer hear.
Air conduction.
Can no longer hear.
We want air conduction to be longer than bone conduction. Bone conduction.
Can no longer hear. Can no longer hear.
Perfect. I'm going to go ahead and move on to assessing the eyes. I'm going to inspect the brows, lashes, and palpable fissures. Inspect the conjunctiva and sclera for color, lesions, or discharge. I'm going to assess cranial nerve 2, which is optic nerve. Looking for gross visual acuity and central and peripheral vision. Go ahead and read the lowest line with both eyes that you can.
DHJBS.
And go ahead and cover left eye.
DHJBS.
Cover right eye.
DHJBS.
And this is going to be your peripheral vision. Go ahead and tell me when you see my fingers come in.
I can see your fingers.
All right, and then I'm going to assess cranial nerve 3, which is ocular motor, assessing for direct and consensual pupillary response to light. Look straight ahead for me. Perfect. I'm going to assess for accommodation and convergence. Go ahead and follow in. Perfect. And then I'm going to assess cranial nerve 3 again, which is ocular motor. Cranial nerve 4, which is trochlear. Cranial nerve 6, which is nuisance. Looking for conjugate gaze with extraocular movements. Go ahead and follow my finger for me. And then I'm going to assess for red reflex and other internal eye structures, such as optic disc, using my right eye, assess her right eye, and my left is, okay. Going to assess the nose, which is look for midline, straight, nasal patency, plug one and below, plug one and below the other. So that's cranial nerve one, which is olfactory. Close your eyes, tell me what you smell.
Vanilla.
How about this?
Coconut.
Perfect. I'm going to assess, I'm going to palpate the frontal and maxillary sinuses. I'm going to assess the mouth, and I'm going to inspect the lips. You want to open your mouth, gums, teeth, tongue, buccal mucosa, salivary ducts, posterior pharynx, palate. Raise your tongue for me, the floor of the mouth, and then put your tongue down, and then try to assess for tonsils, which are 2+. Going to also assess cranial nerve 9, which is also pharyngeal, and 10, which is vagus. I'm looking for soft palate and symmetrical uvular eyes on phonation. So go ahead and say and now cranial nerve 12, which is hypoglossal. We assess for midline tongue without gesticulations. So your tongue out perfect. Moving on to the throat, I'm going to palpate the trachea, make sure that it is midline. I'm going to palpate the thyroid gland. Go ahead and turn your head, swallow, other way, swallow, perfect. I'm going to palpate carotid arteries, signs. I'm going to auscultate the carotid artery now with the bell of my stethoscope to listen for breweries. Turn your head for me and hold your breath. Same way, hold your breath again. Perfect. Now we're going to go ahead and you can flip around for me. I'm going to do the posterior chest. So I'm going to inspect for any obvious signs of deformity, looking for symmetry. I'm going to inspect for any signs of respiratory distress, such as use of accessory muscles, retractions, nasal flaring, tripoding, cyanosis, tachypnea. I'm going to palpate for symmetrical chest expansion. Take a deep breath, and let it out. Perfect. I'm going to palpate for symmetrical tactile frimitus, C99.
99,
Repeat.
99.
Perfect. I'm going to do percuss in the intercostal spaces. And then I'm going to auscultate in the same intercostal spaces with the bell, the diaphragm, below the scapula. Take a deep breath from it. There we go. Just keep repeating. Good. Making sure it goes side to side and down. And make sure I get laterally for the right middle lobe. Okay, I'm going to then also take for egophony. Just say E for me. So what's that? All right, perfect. And then it's probably a long one, but go ahead and assessing bronchophony, which is repeat 99 for me.
99.
All right, and then whisper pectoraliquid, which is whisper 1, 2, 3 for me. Okay. Go ahead and flip around for me. I'm going to be assessing the anterior chest. I'm going to start off by looking for any obvious signs of deformity, looking for symmetry, Going to palpate for tactile firmness symmetrically, saying 99.
99.
Okay, and then going to palpate for symmetrical chest expansion, say 99.
99.
I mean, sorry, take a deep breath. There you go, perfect. I'm going to now listen to the heart tones, or the heart location, starting with the aortic, which is second intercostal space. I'm using the diaphragm first, right of the sternal border. Pulmonic, which is second intercostal space, left of the sternal border. Herbs, third intercostal space, left of the sternal border. Tricuspid, which is fourth intercostal space, left of the sternal border. And mitral, which is fifth intercostal space, midclavicular line. This is also the location of the PMI, so I'm going to go ahead and just palpate that. And I'm going to re-listen to the same locations with my bell. Okay, and then I'm going to listen to the PMI, or the aortic. I'm also taking the aortic pulse for 1 minute. This is at the location of the PMI. All right. The rate is 80, normal rhythm. We can go ahead and lean back here to the 45-degree angle. There we go. I'm going to assess for JVD and jugular pulsation. Turn your head to the right for me and turn your left for me. Perfect. Now we can go ahead and lay all the way flat. Go back. And then I'll just put a pillow underneath your legs for you. Perfect. I'm going to inspect for any heaves or lifts. I'm going to inspect or palpate the auscultation locations again. I'm palpating for any thrills. And then I'm going to auscultate the same auscultation locations again with my diaphragm. And then with the bell. Okay. And then I'm going to go ahead and inspect the abdomen for contour and symmetry. I'm going to auscultate the abdomen, listen for any breweries with bell. Listen to the arteries, starting with the aorta, renal arteries, iliac arteries, and femoral arteries. Okay. I'm going to also take the bowels, start with the right lower quadrant with the diaphragm, right upper quadrant, left upper quadrant, left lower quadrant. I'm going to now percuss over the same quadrants for tympany, dullness, and flatness. I'm going to palpate, same quadrants again for any masses and tenderness. I'm going to palpate the spleen in the left upper quadrant, and then I'm going to palpate the liver, which is the right upper quadrant. Okay. And then you can actually come sit forward now for me. Musculoskeletal, we're going to do, I'm going to inspect the joints of the hand, wrists, and we'll palpate them as well, the elbows and the shoulders. I'm looking for symmetry, deformities, tenderness, redness, swelling, crepitus. I'm going to do palpate for capillary refills on fingers. I'm going to palpate radial pulses. All right, we're going to do range of motion next, starting with the fingers. You're at extension, flexion, hyperextension, abduct, adduct, thumb opposition. And then wrist, you're at extension, flexion, hyperflexion, radial deviation, ulnar deviation, and rotation. And then going to assess range of motion of the elbow. So you're at flexion, extension, and then hyperextension. And range of motions of the shoulder, which you're at extension, flexion, hyperextension, abduct, adduct, external rotation, and internal rotation. And then we're going to do strength of the hands, squeeze my fingers, 5 out of 5. Strength of the bicep, push up, 5 out of 5. Triceps, push down, 5 out of 5. Arms out, we're going to do strength of the shoulders, push down, 5 out of 5. Push up, 5 out of 5. Assess cranial nerve 11, which is accessory. We're going to do that by shrugging up, 5 out of 5. And then we're going to move to assess cerebellar coordination with rapid alternating movement, starting with serial finger opposition. So thumb, and there you go, perfect. Hand flip-flop, start slow and then speed up. And then I'm going to do finger to nose, touch your nose and touch my finger. Perfect, now other one too, perfect. All right, I'm going to then assess the upper and lower extremities of the skin, looking for warmth. I'm going to palpate it as well. I'm going to look for skin integrity, any edema. I'm going to now assess light touch or sensation to light touch. So go ahead and close your eyes. Tell me when you feel this.
Feel it.
Nose,
Feel it.
both the upper and lower
Feel it.
extremities.
Feel it.
All right. I'm going to assess aeruginosis. So put your hands out and put something in your hand. Close your eyes. Tell me what it is.
Corn.
Okay. All right. Keep your eyes closed for me. Hands out. We're going to assess graphesthesia. I'm going to draw
Circle. Plus sign.
I'm going to do I'm going to assess vibratory sensation of the wrist and medial malleolus. I'm going to do it at the proximal ulnar prominence. Tell me if you can feel that.
Yes.
All right. On both sides, proximal ulnar prominence.
Yes.
The medial malleolus. Can you feel that?
Yes.
All right. You feel this?
Yes.
Perfect. I'm going to now assess deep tendon reflex of the brachioradialis. Here you go, relax for me. The bicep, tricep, relax. Perfect. Same thing on the other side. Perfect. And then the patellar tendon. And then the Achilles. And then Babinski reflex. All right. And then I'm going to assess the joints of the ankles, knees. I'm going to palpate them, and the hips for symmetry, redness, deformities, nodules, crepitus, tenderness. I'm going to now palpate for capillary refill of the toes. And then I'm going to palpate dorsalis pedis pulse and posterior tibial pulse. And I'm going to next do range of motion of the toes. So go ahead, you're at extension now. Curl for flexion, hyperextension. Spread them out for abduct, together adduct, and we do range of motions of the ankle. So dorsiflex up, plantar flex down. We do now the strength of your ankle. So push down, 5 out of 5, push up, 5 out of 5. Strength of your knees, pull in, 5 out of 5, push out, 5 out of 5. Strength of the hips, push out, 5 out of 5, push in, 5 out of 5. I'm going to now go ahead and you can stand up. I'm going to do the assessment of range of motion of the knees. So right now you're at the extension, so I have flexion, then hyperextension. But same thing. Perfect. And then for your hip, you're going to do your extension now, so flexion, and then hyperextension, and then you're going to do, you got to do both legs. There you go. Now we're going to do abduct, other leg 2, and then adduct, and then you're going to do circumduction, and then same one for that. Perfect. And then you're going to do, so you're standing, close your eyes for me. We're looking for assessing Romberg, looking for any swaying. And then you're gonna open your eyes now, and just assess gait by taking normal steps forward, turn around, assess tandem, so heel to toe for me. Perfect. Good. And then I'm going to assess, you can hop on 1 foot for me if you feel safe. Perfect. All right. And then I'm going to assess range of motion of your lumbar spine. So you're at extension, flexion, then hyperextension, sorry, and then lateral flexion, and then rotation. Perfect. And then we're going to assess the range of motion of your cervical spine. So you're at extension, flexion, hyperextension, lateral flexion, and then rotation. Perfect. And then we're going to, you can turn around for me. I'm going to assess the spine for any tenderness, normal curvature, for alignment. I'm going to, if you can go ahead and flex forward for me. I'm going to look for any signs of scoliosis. You can go forward a little more if you want. There you go. Okay. Yeah. I think that's everything.